you're predominantly in the north. Give us a sense of what's happening on the ground there.
So there has been an unprecedented spike in the number of cases, far outstripping what we expected. The question is basically that the first wave, which led to a maximum of 100,000 cases a day, we are now 300,000 and counting. So what it has done is stretched the healthcare infrastructure to the limit, and it's actually beyond that right now. The basic thing is to see how we could actually fight at all the fronts. So the first front is to try to reduce the burden, reduce the numbers of new infections. And there has been a huge drive from everybody, the government, the experts, the doctors, everybody is appealing to the public to go back into what we call personal lockdown. Because we don't want to, are in the wisdom that another lockdown countrywide would be quite difficult for India to sustain. So that is why it is important that every citizen of India participates in this war against this terrible virus. The second is that the infrastructure, that means the medical facilities, the doctors, the nurses, the paramedical, they have been stretched for the last year now. But I am quite happy to tell you that the spirits are not down. People are still, the doctors and the frontline workers are still determined to actually lick this pandemic. Anyway, right. Besides that, what we need is the support of medicines and oxygen and stuff like that, which is very stretched. But there are efforts being made, like new tankers are being flown in from all over the world. We have enough manufacture of oxygen, but we don't have the delivery systems. So logistically, it's a nightmare right now.
Help us understand why India is facing this crisis right now. Is it because of a lack of preparation since the peak that we saw previously? Was it complacency that led to this?
You know, if you look at it, this has happened around the world. I mean, what you estimate and it exceeds that, then naturally the system starts creaking. I mean, it happened in New York, it happened in many cities of the United States, it happened in Italy, it happened in many cities of Europe. So it's not unique that it's happened in India only, but I'll tell you, what did UK do? UK said, if you are above the age of 75, 80, we were not going to admit you. You can go home and whatever happens to you, happens to you. India has not done that. India is taking care of every citizen that is getting sick. Now, that's remarkable. The second thing is there are difficulties. There is a lot of pain, but we will get over it in the short order because the shortages of oxygen are the one that is causing the main problem. And it is like I said, it is the transporting logistical nightmare, which has to be corrected ASAP. So all the things are being done, but we are hoping that if you see in the last 7 days, after breaching 300,000, the numbers have not gone up like they were going exponentially every day. They were kind of doubling every 4-5 days. So that has ceased. Mumbai is showing a better trend. The latest Sero survey of Delhi is showing that it had gone up to all the people who were tested with for COVID, almost 50% tested positive. Now, in the last week, it has come down to 33%. So maybe the wave is blunting now. That's what we are hoping for also while we prepare for more and more infrastructure. So I'm optimistic that we will get ahead. And I'm very pained by the fact that a lot of people are suffering. And we should be able to provide them relief as soon as possible. We must stop these people who are sitting on the street getting oxygen. We need to create those facilities. They are being done right now. I guess not fast enough. But this is what the determination is and will be delivered to our people in the coming months. Yes, sir.
Doctor, are you concerned from a pharmacological perspective about this pathogen as a double mutation and some even talking about a triple mutation and how that could blunt the efficacy of some of the vaccines there?
Yes, we are very concerned. In fact, the trend, if I tell you, younger people did not get affected so much in the first wave. Today, a good 40% of the people are below the age of 50. Now, of course, what we are noticing is, even now, that people who have received both their jabs are 2 weeks beyond their full vaccination. Even if they are getting it, they are getting very, very mild symptoms. So that's also a hope, because a lot of doctors who had already been vaccinated, when I say a lot of means maybe 10%, they are getting infected again, but they're all at home. We have not needed to hospitalize even a single one of them. And the fact is that they are feeling quite healthy and they're wondering whether they really have it or not. So this was predicted that after vaccination, even if you get it, you'll be a milder form. But it also tells you that we cannot let our guard down, because the virus is still around. And you can get the virus even if you're vaccinated, and you can transmit it to others who are not vaccinated. So the vaccination drive is it's not adequate today. We are ramping up the production, and now the private sector has been allowed to go and vaccinate as many people as possible. The only bottleneck is going to be the availability of doses, because our population is very large. We do have 70 million to 100 million doses per month available now, and we are hopefully ramping it up even higher in the next month or so. Once we get there, I think we would have moved towards herd immunity, which will be one of the weapons against this terrible virus.
Doctor, what about rural areas and getting the vaccines to those parts of India? How are we doing with that? And are you involved with the whole process of vaccination, the vaccination program there? And tell me, we've been hearing about shortages and the like.
No, there is, like I said, we have been involved with it from day one. And all the segments that have been eligible for vaccination, we have been participating with the government from day one. Now what's happened is that the government has said that the private sector or the industry, whoever it may be, can buy the vaccine from the manufacturers. The details are being worked out to be announced today or tomorrow. From 1st of May, we can step up. But as I said, one, the import of vaccines has been allowed, which was not allowed. The money for supporting the manufacturers has been given out to say ramp up, ramp up, ramp up. Hopefully they'll deliver. Now we have 3 vaccines in India. One was AstraZeneca, which was licensed to Serum Institute. The other was made in India, the Bharat Biotech one, which we call Covaxin. And third, the Sputnik has passed the rigors of scientific evaluation, as now is on the market. So all these 3 vaccines put together will probably get us to about between 100 and 150 million doses a month. And today, we already have vaccinated over 150 million people. And that's the important part, that we reach towards our stated goal of minimum 300 million people getting these 2 doses. And then we expect, with the Sero survey showing that 30-35% of the population has already developed antibodies, whether they knew it or not. So with 60-65%, we will be moving very rapidly towards herd immunity, and that's the hope, and that's what we are living on.
Dr. Trehan, vaccine prices were raised recently. Do you think that is justified?
The basic thing is, any country that is suffering shortages and every human being wants the treatment now. It is true. It is around the world. But unfortunately, there are not enough doses of vaccine available around the world. Now you see, United States started in January with a population of 350 million people compared to India's 1,300 million. They have taken so long, and all of the United States is still not vaccinated. We are hoping in the next 3 months we will vaccinate the critical mass. So this shortage is not man-made. It is virus-made, and the inability to produce doses which are required around the world. So there are countries which have not even started vaccination. India is fortunate. We are the hub for vaccine manufacturing. So hopefully, within the next 2-3 months, we should be able to overcome this crisis. But this current crisis of oxygen, I'm hoping by next week we will have enough supplies, because logistically all the systems are worked out today to deliver. But today, I may tell you, even we are living from moment to moment, because the delivery comes when you have 2-3 hours of oxygen left, and then they keep you going. But that is a nerve-wracking feeling, yes. But we are assured that because there is enough manufacturing of oxygen, especially in the steel industry, and they are willing to close down their plants and deliver the oxygen. The shortage was of cryo tankers because it's liquid oxygen. That is, if you see some visuals from India, every day the big lifters, Air Force lifters, are bringing in tankers from all over the place, including Singapore, including, I think, any country which has extra to lease to us. We are bringing it in. We are transporting them on rails so that they can reach the destination faster. So all this is being done, and I hope that within the next few days we will have some relief from all this crisis.